Good morning. This is Idaho State Senator Kevin Cook, and just wanted to check back in and let you know what I've been working on. Last week I was in Boise for some meetings and visited with the project manager of the new MMIS system. That stands for the Medicaid Management Information System. This is a new system that is used by all providers for billing and payment, and also to determine eligibility for Medicaid. This is a huge system, very costly. We're going to implement a new system. They're going out for an RFP to get a contract with somebody to come in and create this system. I have been working on this for over a year now, trying to figure out how we can lower the cost and lower the risk. And the federal government is very much involved with this. They pay 90% of it, and in the state of Idaho will pay the 10%, the rest of it. We talked about the schedule, the scope changes, if there were scope changes, just overall how things are going, how the schedule is. And like I said, the RFP is going out next week. So that's good news. Like I said, it's a very expensive project, but it will be huge for Idaho to be able to ask questions, to determine eligibility, and to say, well, what if we did this? Will it save us more money? Or what if we did this? Does it give us cost containment within Medicaid? So it's huge, something we need to do. A little on a different subject, but coming from the same department, let's talk about the Medicaid protection. Medicaid protection was put in place in the beginning of the COVID-19 pandemic and provided continued Medicaid coverage for individuals who may have otherwise been ineligible. Congress received recently passed a bill, first of the year, or even before that, recently passed a bill that ends this continued coverage. So it says the Medicaid or the COVID-19 emergency is over as of April 1st, 2023, which has passed. So what does this mean? This does not mean that if you're on Medicaid, it doesn't mean your Medicaid coverage will automatically end on April 1st. Even if you are receiving Medicaid as a result of the special protection. What this does mean, though, is when the Idaho Department of Health and Welfare determines eligibility for Medicaid for April 2023 and beyond, it will no longer keep ineligible individuals on Medicaid, as Medicaid protection no longer applies. That's the end of it. Department of Health and Welfare begin processing reevaluations of all individuals who are receiving Medicaid coverage under this protection beginning in February. So they've already started this process. They will occur in phases, so they're not doing everything all at once. They're going at 1 month at a time, and they'll be through. They're estimated they'll be through come fall 2023. But here's some good news, some statistics as of Monday. So they update these statistics every Monday. There are 154,857 total people in the Medicaid protection. 50,944 people have been reevaluated since February, and of those, 20,171 have been determined eligible, and 30,773 have been determined ineligible. And so those will be coming off the Medicaid because they're no longer eligible for it. And so this is huge, this is big, this will help us cut down our Medicaid budget and get it under control. And there's lots of things that I'm looking at, little programs, and maybe we'll talk about those next Saturday or sometime. Some of the little things that we're trying to do to, again, cost contain the cost with our Medicaid budget. And so working hard on it, and excited about some of the things I'm hearing as I'm working on it, and we'll talk about it later. But if you've got any ideas to help with this Medicaid, I would love to hear from you. Give me a call, let me know what you think, or a text, and love to talk. So anyway, it is a beautiful Saturday morning. I hope you enjoy the weekend. Talk to you later.